All right, good afternoon, everyone. We are going to, I believe, begin with a video, and then you'll hear from me again, as will the people in the virtual room. So just a heads up, if you wouldn't mind taking a seat, and we'll get started in about a minute. Thank you so much.
When the secretary came here in September, he charged us with looking at what we could do to improve our health care for our women veterans.
We have launched our gynecology self-referral program. It is operational, and we've gotten wonderful feedback from the women veterans about it.
When did you start?
We launched on October the 17th.
So in less than 3 weeks from his time here to start this new initiative.
Absolutely.
What does that mean for a woman veteran that's out there that you maybe want to share with them?
Well, it definitely improves their access. And ultimately, when they can get access to important care quicker, the outcomes can be improved. They have somebody navigating them. This is the kind of care you need, and here's who you go to. Gotten some positive feedback with people who had some very time-sensitive care needs.
So there were a couple of people that had a cervical cancer diagnosis and needed a rapid referral. It improves the self-care and the referral process for our female veterans, and we have the largest female veteran population in the country. GYN covers so many different things that we could have done. Dr. Pittman worked with our systems redesign, how they looked at it, and how we came to this pilot that we're doing here in Atlanta.
We cut down the time that all the women veterans were spending waiting in between different referrals and the time that they were trying to get the appointment.
And I understand we grow about 100 new patients a month in Atlanta. This is a big deal to those 100 veteran women.
Having people that are very focused on what those care needs are, they're able to get their care quicker.
We have a mantra in women's health. Listen to the woman veteran, prepare for the woman veteran, and welcome the woman veteran. And this self-referral process encapsulates all of that in one, because we have a team ready to talk to the veteran when she calls the phone.
All right, thanks for that video, Mike, and to our women's health team for the great work that you all are doing to provide self-referral. You'll hear more about that from Dr. Pittman when she comes up. I just want to give a couple of quick notes, as I always do. First and foremost, which is not on the screen, is our next Veteran Town Hall for this fiscal year, which we're in FY26, will be held at the Pike County VA Clinic on Thursday, March 26th. Now, you don't have to write this down. It's on the website. It's on our social media. It's also been sent to all of our digital newsletter subscribers. So we have the dates locked in. All the locations are different per the request of our executive leader, Mr. Mentzer, as a way to meet veterans where you are. So that rotation will continue. We also want to thank you for being here today. Welcome all the new folks who've never been to a town hall, and I see a lot of familiar faces as well. So thank you for your continued support and holding us accountable in things that you need as veterans. Want to gently remind you, please don't share any personal health information during the Q&A session. We have staff here who are out in the halls, SMEs that are here in the room as well, and we will make sure that we have links and phone numbers for those that have opted to join virtually. This will be recorded, so that means it'll be on our YouTube channel probably by this time next week, if not sooner. And it'll also be on social media. So we'll make sure you have those links along with the pictures so that you can catch up on anything you may have missed or if something slipped by. General reminder, we do have the SMEs out in the hall for those of you who are here in person. So ask away if you have questions. During Q&A, a couple of hands might go up to direct you to the right person on Team Atlanta for assistance. And then we'll have those updates in the chat. Here you can see for yourself the agenda for today's meeting. So next you're going to hear from our fearless leader, Mr. Kai Mentzer, and then you'll hear from our colleagues at VBA. Thank you.
So we're going to do the VBA. We've got the acting director, Corey, here is going to give some words. And then we've got GYN, suicide prevention, our chief engineer, Mr. Minley, Miss Alexander, which maybe we'll be able to talk about the gym. And then this is one of our veterans that's asked me a question a minute ago, caught me off guard. And then Miss Lee's going to do some access, and then Mr. Burton to talk about My Healthy Vet, and then Miss Ramos, and then I'll do some question and answer. So Just some real high-level information, as I typically do, and then we'll get to some of the weeds. 2 weeks ago, we were notified for the veterans in the room, and I guess the staff, because you might not know this, we were notified that the Atlanta VA healthcare system was the third most improved VA in the country for the customer satisfaction. So you as a veteran are filling out the surveys and telling us how we're doing. We're not where we need to be, right? We're still not in the middle of the pack and or at the top of the pack, but third most improved. So what we are doing is working, right? And so that was a big deal for us. It illustrates our desire to continually improve. It illustrates my desire on accountability. And if we're not improving, then maybe this isn't the right place for some of us. It's called the Survey of Healthcare Experiences. So the VA is working on this, but it's definitely not where it needs to be. I get it because I get my care in my system, but it's like 12 pages printed out and mailed to you. So if you get that, that's where these scores are coming from, and then you have to mail it back. And the VA is looking at ways to turn that into electronic for us so that it makes it easier and we get some more responses, because we have a very low response rate. I think it's less than 10%, okay? And it's based on the last 12 months, so it's not just a one and done. This is a 12-month aggregate. So this isn't just, you guys did a great job in 1 month. This is where we're headed in the right direction. And when someone shared this with us, it showed that over time it's been increasing. So I look forward to the continued progress. And then I think it goes on to the next list, goes on to our Chief Experience Officer, but a couple things I want to share. One is next week I'll be in Washington, D.C. with the Secretary's office. So all the directors in the country are coming together. I was talking with a gentleman here, Craig, about some of the challenges we've had in the last year. And I think back to like the last time we had a town hall and we were in this area where we couldn't really hire. And since then, they've given us the approval, and we were like at the floodgates. And as soon as that opened, we just let all the. And at our last new employee orientation, we hired about 42 people. At the one before that, it was about 50 people. And our plan is to continue to do that, continue to proceed doing that, because a lot of the challenges that I see as a patient, a lot of the challenges that I hear from you as a patient isn't always driven by a single provider, clinician, scheduler. It's driven by the challenge of every day they have to do more than yesterday. Every single day we have to come to work and run this marathon without an end in mind. And so my goal next week is to have conversations with central office about that and just really help them from a healthy perspective realize that we are growing. We grow by one whole hospital every year in customers, right? So some of my colleagues have 40,000 patients. We can grow by that in 5 years. Some of my colleagues have 20,000 patients. That takes us 1 year to grow. So they have a whole medical center for what, and we can't hire a whole hospital in a year, right? And I can't build a hospital in 10 years. So I'm trying to get central office to understand, you know, I've always thought I was special. My mom will tell me that all the time. I need people to see that Atlanta is special, right? We are growing so fast that we need the resources to be able to do that. In order to get those resources, I need those folks in central office who have never spent a day in my hospital, a day in any of my 22 clinics to better understand that. So since our last town hall, we've had the secretary come to visit us a couple of times. He came on Thanksgiving Day. If you follow us on Facebook, you'll see that. I got the call 2 days before. They said, if you're on vacation or on leave, I don't want you to come in. I was on leave, and I respected that. And I had an acting director, the nurse exec, Dr. Hampton, who's at the hospital now. She's from the area, and she said, well, I'll make the time. I'll go in and visit with them. So he's going to be in there for 15 minutes, but he spent an hour and 15 minutes with us. He walked around, talked to the patients, had a great visit with them. And then the one before that, he spent half the day with us. And we were able to talk to him about the challenges, able to share with him the growth, able to share with him, you know, he wants us to improve access, but we don't have anywhere to send the veterans, right? Primary care in the community is just as saturated as it is as my hospital. So I'm not going to improve that access without more staff. And I'm only going to get to a certain level before I need more space to be able to do that, right? We have the largest population of female veterans in the country, but we don't have a standalone building for them. Why don't we have a standalone building with the largest population of female veterans when other sites of half the veterans we do have their own standalone building? So trying to help them understand that we just need to be treated differently here in Atlanta. And I'm not advocating to take away from somebody else. I'm adding to add to what we need. So lots of change happening at the VA. We've hired a chief experience officer since the last time, Amy Whitaker. So she's going to get up and talk to y'all for a little bit, but she's going to kind of be that point person for us to go to for all things, to collate the information so that stuff isn't dropping through the cracks. She's going to be overseeing the patient advocate's office and a new office for our employees called the experience office for them, right? Y'all have heard me say this, and if you haven't, I believe in investing in the staff so that they invest in the customers that come to them every day. I believe that our staff they're willing to give one more inch in that never-ending marathon if I continue to support them. So I know that we have to change that experience for them. We have to do everything we can to improve that. And so we brought Ms. Whitaker on in October. So I'll turn it over to Amy.
Surprise, you're talking in front of all these folks I didn't know about, but I'm so thrilled to be here today. So I believe in compassionate care. I believe that veterans deserve the most compassionate, high-quality care out there. I know that we have not always made it easy for you, and I'm here to do everything I can to fix that. So I appreciate you sharing with me your experiences that have been great and ones that haven't been great. And I promise you, it's not always as quick as I would like it or I know you would like it, but I promise you we are committed to making this experience better for you from when you walk in our door to most certainly how we talk to you and how we treat you. And we're committed to that. And so I'm excited to be here as part of that role. So I look forward to meeting all of you.
So we're going to bring up Sheila Rauch. We're not bringing her up. I'm supposed to go through this? Oh, okay. Hey, thanks, Amy, for taking that. Let me put this stress ball down. Dr. Rauch. Okay, so I met Dr. Rauch over at Emory, actually, and she's Emory's a big affiliate of ours, and they've got a really nice mental health program. And I had an opportunity to go spend some time with her, with the secretary. This was a while back, in the program that she's leading for our rural veterans. So this initiative, it focuses on bringing prolonged exposure, right? PE, we love acronyms, a gold standard evidence-based psychotherapy, PTSD, right? Directly into the primary care settings. Our infamous, now famous, Dr. Mizell. Dr. Mizell's over our emergency department. Dr. Mizell and I met yesterday, actually. You'd think I wouldn't do anything at my desk, all this walking around. Yesterday, we are recognized as, I think we're the only VA? Don't quote me on this, but it's close. Level 1 geriatrics care in our emergency department. So we talk about all the great things we do. So he and his team recognized earlier than 2020, 2018 recognized that we don't provide the best care to our geriatrics veterans in the emergency department. So they require special care. And the team said, let's fix this. So there's 4 different tiers of geriatric certification in the emergency department. We quickly got to tier 2 in the geriatrics area in the emergency department, but tier 1 was a little bit more challenging, and we just met that tier last week. I think there's 5 hospitals like this, private sector and ours, in the state of Georgia. So I'll let you know, there's 1,000 hospitals in Georgia. I'll let you know the seriousness on this. And what this is it's taking that veteran when they come into the ED, making sure that they can see, making sure that we have things in place for them to see. We have a specific area for them. They might need certain things that others won't need within the hospital. So we recognized him and his team yesterday for that geriatrics emergency department accreditation. That's it. Okay, I survived until we get to question and answer. So now we're going to bring up our VBA colleague, Corey. Corey just shared with me that he came from the Birmingham area. He's the director of the VBA there, but acting as the director here. Are you also covering Birmingham and us at the same time? So he's covering 2 regional offices, right? So the regional office, those folks that give you your ratings that you've earned, right? So I'll turn it over to Corey to talk a little bit.
My mother also told me I was special. Thank you. So, good afternoon, everybody. So Corey Hawthorne, and right now the acting director here at the Atlanta VA Regional Office. Thrilled to be part of the team, and been with VBA 25 years, and I've been the director at the Montgomery Regional Office that services the whole state of Alabama for the last 11 years. Great team over there. Rough football this past weekend. All you Bulldog fans are thrilled right now, right? And the Tide fans over where my family lives, not so much. But appreciate our partnership first and foremost. Much like what I'm used to over in Alabama, everything I hear from Angela and team at the VA Regional Office is rave reviews about the partnership between the Veterans Health Administration and the Veterans Benefits Administration here in the greater Atlanta area. Always teaming up on town halls, things like this, always making sure that as well we have staff that's present when we're at events like this, so that if you have questions individually about your claim, we can meet you right where you are, answer those questions, do the right thing for you. If you're in the greater Atlanta area, obviously you know we're co-located on the same campus as the VA hospital, open regular business hours, so if you ever have a question, you're welcome to come in, 8 through 4-ish, and we stay until the last person in the waiting room is taken care of. Just two quick things. Many of you may have noticed does everybody remember the thing called the government shutdown? Not long ago? Okay, right. So Team VHA was very lucky in that they had appropriations. They didn't really skip a beat. VBA, we continued to process claims throughout the entire furlough and through the shutdown. However, we were shuttered when it came to some of our services. That included public contact, that included vocational readiness and employment. And we are thrilled. Some of you may know that there's some more budget questions coming up towards the end of January. But VBA is part of an appropriation that takes us through the whole fiscal year. We're not going to have any kind of issues with that. So if you see there's any kind of shutdown again, nothing in VBA will be affected this time. Our doors will remain open. There'll be no issues like that. If you're a VRNE participant working towards employment, again, you'll have no skip when it comes to meetings with your counselor, and you'll have no discontinuation of services during that time. So that's a really good thing. Last thing, absolutely, we're very thrilled, and our employees who weren't paid for 6 weeks as they continue to work the claims are thrilled too, right? Last thing I will share with you is in VBA, we just broke our own record in terms of number of claims that we completed last year. We completed over 3 million compensation and pension claims last year. The previous year to that, it was 2.5 million, so VBA far surpassed that. Very lucky with our staffing. We had a lot of people start with us during the PACT Act when the PACT Act was passed. Those folks are now trained up, and we're able to have even more firepower, turning claims around faster. And the last piece with that is we have been steadfastly just dialed in towards making sure the veteran who has waited the longest on a decision is served next. The backlog has decreased this past year from over 200,000 claims. So who knows what a backlog claim is in VBA? Anybody? Oh, well, no. Well, so that would be an appeal. So you can continuously appeal. You can appeal. Any regular claim that comes in for a new claim or a reopened claim over 125 days, we refer to as a backlog claim. We had over 200,000 of those in our inventory about a year ago. We're down to 111,000. We are working towards getting under 100,000 by the end of this calendar year and continuing to chip away at that. I will tell you, that's national. That's on the national level in VBA. And that we knew that backlog would grow because that backlog grew because there's so many more veterans eligible for benefits now because of the PACT Act. So we knew we would be going up a hill, growing a backlog because more veterans were filing claims. Now we're starting to come back down the backside of that hill, making sure that we're getting the next oldest claims adjudicated as we have the evidence that we can make the decisions on and be able to serve veterans as timely and efficiently as we can. So I'll close with just sharing again, thank you for the great partnership here. Looking forward to being part of Team Atlanta for as long as they'll have me and until they fill that role, unless they make me come over full time and make me move from Alabama. But appreciate it and thank you for your time.
Thank you. Yeah, what a game. Before I turn it over to Dr. Pittman, thank you, Corey. It's been a great partnership with VBA, and I know that Angela has done a phenomenal job of reducing the amount of time that it takes to process a claim here in our VBA office. So when the veterans come and they tell me it doesn't take any time at all, it tells me that that it's working. So I really appreciate what you guys are doing. So we're gonna have Dr. Pittman come up. A lot has happened, and this was my promise and my commitment, is that we're gonna continue to change constantly. Since our last town hall, the secretary came to visit, and he said I would, and you know he's from Georgia. He lives up in the Gainesville area somewhere, right up at Lake Lanier. He said, I would like you guys to be the pilot site for a GYN referral program. I'm like, what in the world? Or, you know, so I've Dr. Pittman talked to us about this a little bit, but he said, I need you to do this in 2 weeks. Man, we can't do anything in 2 weeks. Like, you know, it takes us 2 weeks to pay some. I mean, it's hard to do anything in the government in 2 weeks. So he said, I need this done in 2 weeks. And so, you know, we said, yes, sir, right? And he left. And we started working with his folks in central office, and they said, actually, we think this is going to take months. And we were like, well, I mean, I don't think we can do it in 2 weeks, but I don't think we got more than a month. So in about 3.5 weeks, we were able to establish a new program where, as a female veteran, instead of calling your primary care provider, you can call the female clinic, the women's clinic, and say, hey, this is what I've got going on. And they'll triage to make sure you're in the right place. So just like my wife, who's not a veteran, gets care in the community, she's able to call her GYN and do the same exact thing. So now we're starting to do it. We started to do it in Atlanta. We're at like 240 different calls and, 15 or 20 calls a day. It's in place. It's sustained. It's working really well for us. So then the secretary's office found out we were doing a great job, right? I'd like to tell them. And they're like, oh, we want to roll this out across the country. Well, in the rest of the sites in the country, there was some pushback. Oh, we can't do this. We need more resources, right? A little bit different than our approach, right? We're going to figure it out. We're going to find the resources, right? And so they paused it. And they paused it for like 3 days before they said, no, wait a minute. Kai did it in Atlanta. You guys need to figure this out. And then they restarted it. So very fortunate to have Dr. Pittman's leadership to help us get through that. And really proud to be, the director here in Atlanta, to have the site that did that for our female veterans. So thanks, Dr. Pittman.
Awesome. Thank you, Director Mentzer, for introducing the GYN referral process, self-referral process. My name is Dr. Jamia Pittman, and I am the Women's Health Medical Director, and I am so excited to see you all. And I do see you. I also see all of our women veterans. Thank you for your service. Thank you for being here. Thank you for your ideas, because we listen to you. We have a mantra. I don't know if you guys were here to see the video. I guess, I have to be okay with all of this media coverage, because our media department is so wonderful and ready to film us at any moment. Case in point, over here. But we did a little promo, and as a part of the promo, I mentioned that we have a mantra within the Women Veterans Program. And our mantra is, listen to the woman veteran, prepare for the woman veteran, and then be ready to welcome the woman veteran. So how do we listen? We listen through town halls like this. We listen through focus groups that we hold quarterly. We listen in our women's only town hall, where we get to have more intimate conversations, and our next one is in April. We listen to the SHEP scores, so those surveys that the director talked about, super important. Please give us feedback. And we also listen when you guys tell us through the secretary or in other ways, because we feel that this is how this happened, that something more needs to happen for our women veterans. So as the director mentioned, our secretary of the VA, Secretary Collins, came down, and he championed us to develop this particular referral process based on our interdisciplinary collaboration with not only the Women Veterans Program, but System Redesign, who was amazing, gynecology, nursing. Oh my gosh, the nursing support has really helped us to make this come to fruition. And also our entire healthcare facility. We were able to design it, and we were able to launch it on October 17th. We were the proof of concept site, which means that if we proved that we could do it, then others could do it too. Yes, yes. And so you guys are a part of leading the way in healthcare. We are all a part of it. You are the most important member of that as our veterans. So we did that, and I've already talked about it. This particular initiative, I think, was also inspired by the Secretary's commitment to develop ACE, access, choice, and excellence. And this is the Women Veterans iteration of what's possible when you pay attention to ACE. And so this self-referral, it works like this. You call the regular number, 404-321-6111. You select 2, and then you select 4. And when you select 4, we have a team ready to receive you. The phone will be answered by an MSA who is delighted to speak with you and will say things like, yes. Thank you for that. Medical support assistant. And the MSA is a part of our HAS team, which is the business arm of the administration in terms of answering the call, making appointments, and making sure that information is routed correctly from the business side of the house to the clinical side of the house. So the MSA answers the phone and says, thank you for calling the Atlanta VA. How can I help you? And then they listen to the information from the woman veteran, and then they quickly let her know, we have a team of providers waiting to assist you, and we would like to transfer you now to our triage nurse. Then our triage nurse talks to the woman veteran about the clinical scenario. And they go into detail. She takes notes. And then we have a few options after that. After the triage evaluation, we have a few pathways that the care can take. And this is what's so special about this. You don't have to have a primary care consult for this. You simply call the number, connect with us, and we develop in a shared decision-making manner the next steps in the plan. That plan could very well be that a woman veteran needs a routine cervical cancer screening or a mammogram. And so the nurse talks and says, okay, well, I know that your primary care provider is trained in women's health, and I am going to make an appointment for you to see her within the next 2 weeks so that you guys can talk about, so that you can get your cervical cancer screening done. And I'm also going to go ahead and ask her to put in that mammogram request so that it's already cooking with community care before you get there. Or let's say there's a complaint that needs more urgency than 2 weeks, because sometimes women, we have things that happen that we can't wait for. We just simply cannot. So then we have a team of nurse practitioners and myself that serve as a medical officer of the day. So I am doing work, but I'm also available to do a VVC Now appointment for a woman veteran that the nurse indicates to me on the Teams chat needs to be seen now. I tell them I'm available. We put in her email address, and then I put in the information that I need to put in, and then we are face-to-face within 15, 20 minutes. It's called a VVC Now, and we talk about what's going on, and we develop a plan together. Yes, do you have a question?
What's the patient load capability of the VVC Now? What's the daily patient capability of that? What's the patient load capability of that?
Well, we've set up a clinic for about 13, 14 slots. So we're there. We're there. Thank you. Now, let's say that we don't need a VVC Now. Let's say that the woman veteran lives in Oakwood or Blairsville. They need to be connected to care near them. Then we get to interface directly with our community care team, reassure that we're going to put in this consult that meets best medical interests, and move on to community care. We track everything that we do so that we can make sure that we have closed loop communication. Now, thank you for listening to the nuts and bolts of the operations. Now I want to just tell you a brief story about how this has helped already. We received a call from a woman veteran, and she indicated to us that she was in her late 30s and had just been diagnosed with breast cancer. She had served in an area of military toxic exposure, and we know that the age for routine screening for breast cancer is typically 40. But because of some of the military exposures that women veterans experience, we have to be cognizant and screen earlier when we know that there's been that exposure. So she was diagnosed with breast cancer. She found out about the referral line, and she called. And she talked to the triage nurse and said, listen, I start chemotherapy next week. I'm 38. I may want to have children one day. I may want to have a family. How can I get into a fertility specialist to get my eggs harvested and frozen so that if I want to have children later, I can? Now, with the old way of doing things, she would have had to wait 2 weeks for a primary care appointment and get a consult. But with this new way of doing things, which focuses on access, choice, and excellence, we were able to place the community care consult for the fertility specialist. GYN, we did a warm handoff to GYN. They made whatever was necessary happen, and she was seen in 2 days at the fertility clinic, eggs harvested and chemo started. And she was so appreciative. Yeah, round of applause. So as a part of the proof of concept and the feedback to national regarding whether this works, we told them yeah. Yeah, we told them yeah. So thank you for listening. We have other things coming up for women veterans as well, new programming, but we just wanted to highlight this today. Thank you all so much.
Hello, everyone. My name is Lamisha Edie. I'm one of two Compact Act coordinators. My partner is Whitney Jackson. I don't have a promo, but I do have good information and brochures to provide to everyone. So just want to tell you a little bit about Compact Act, and Compact stands for Comprehensive Prevention, Access to Care, and Treatment Act. And basically with Compact Act, the goal is to decrease suicide occurrences amongst our veterans by removing that financial barrier. And so in doing so, it will allow for them to be able to seek emergency care when they have expressed to their loved ones or to a licensed provider that they have thought about harming themselves, perhaps with a gun or with a rope, or they have attempted. We don't want financial barriers to be a reason that veterans do not seek care. Next slide. So who's eligible? Veterans have to have a veteran status, and basically what that means is that they have to have served more than 2 years of active duty and have been veterans of armed forces reserves that have been discharged under conditions other than, basically, you need to be honorable or have general under honorable conditions discharged. We do not, unfortunately, veterans who have a humanitarian status do not qualify for Compact Act. However, we do partner with eligibility that if they do get that status change, we will work with them to get them approved for Compact. So what does Compact Act provide for veterans at risk for suicide? Basically, on the Compact Act, if a veteran meets the veteran status criteria and upon reviewing clinical documentation from the facilities, either Peachford or Wellstar or inpatient facility, they will receive up to 30 days of inpatient care at no cost and up to 90 days of outpatient care at no cost. And also what's good is because typically people who are receiving inpatient care is usually up to 2 weeks, but sometimes, for instance, if a veteran made a suicide attempt, perhaps maybe pill overdose, they may also incur what we call a sequelae, a medical sequelae, and so they may need care that extends past those 30 days. So it may say be 6 weeks. With Compact Act, we, Ms. Jackson and myself, and our clinical team are able to extend a one-time, extend it for 30 days times one, meaning that if they need 6 weeks of inpatient care, we can extend it for one time for 30 days. So that means that they will receive inpatient care up to 60 days versus just 30. Also, too, they will receive 90 days of outpatient care. And one of the great things, 90 days of outpatient care, and that's through the VA or also out in the community. So one of the great things about Compact Act is that veterans have the option of receiving care out in the community. And one thing I skipped over is that they don't have to be enrolled in VHA. They can receive care whether they're enrolled in VHA or not. But one of the things that we do, because we're also post-discharge coordinators as well, so we are notified whenever veterans are receiving care out in the community. So if we have a veteran that's not enrolled or connected, we get them connected. And also, too, lastly, Compact Act does also cover associated costs with that suicide risk emergent event that they incur. So for instance, if a veteran goes to the hospital or maybe their loved one call the ambulance, they don't have to worry about the cost of the ambulance ride to the hospital under Compact Act. They also don't have to worry about medication. That will be covered under Compact Act if they meet the criteria for Compact. So how can veterans appeal the decision made? So one of the reasons that Compact Act is here attending the town hall meetings is because we're trying to get the word out about this benefit because it's really great. And we're trying to increase the numbers. And so some veterans, because it is pretty new, some veterans may have sought inpatient care and received a bill. This is how they can appeal that process if they're charged or if they tell the hospitals and they don't charge the VA. So they can contact a patient advocate. They also can submit it to VA billing inquiries. They also can contact Community Care Office, or they also can contact myself and Whitney Jackson. So thus far, we have been in our role since January 2024, but Compact Act really started nationally, we'll say in 23. Well, we've been up and running since 2024, and we have reviewed 2,627 cases, and we've approved 1,251. What that means is that we receive Atlanta. Everybody loves Atlanta. So we receive veterans from everywhere. And some of our veterans are very transient, but we process everyone regardless of where they come from. So the total number of Compact episodes of care for 2025 reviewed has been 1,340, approved 577, and still counting.
Ms. Edie, how do they get a hold? What do they do if you're a veteran that's in crisis in a hospital?
So if you are a veteran that's in crisis in the hospital, make sure that you tell them that you're a veteran. One of the things as we're building our relationships with community care providers, particularly with the hospitals, because oftentimes they'll say, well, we don't know, the VA is just so intimidating. So we've talked with them about, with the intake eligibility, asking an individual, are you a veteran? And we've given them different ways to ask that question. So that's most important, letting them know that you're a veteran. And once you do that, they will notify us. So veterans have, it's not in the slide, but veterans or the facility have up to 72 hours to notify the VA that a veteran has sought care at their facility. And what that does is, one, it notifies us, and then it starts the authorization process for care. So it's really important, but it also triggers us to start reviewing the documentation to see if the veteran can be approved for Compact Act.
So we send out on a quarterly basis now the message to our veterans, to every veteran, to let them know about the 72-hour rule. So that's within 72 hours of getting care, you have to tell us so that we can help provide coverage for those bills. So if you don't have that, look forward to getting that on a quarterly basis for those folks that are going to be listening to this afterwards. It's that phone number that they can call to give us that heads up. And then we also rely on that hospital provider to help us with this. This is the secretary and the team, this is central. This is all of us in VA saying, if you're in a mental health crisis, we want you to go to a hospital. We don't want there to be any barrier for you not to get that care. And so this is our way of saying, money should not be an excuse. Concern for that ambulance ride should not be an excuse. Right. And so Congress allowed us to do this with the Compact Act. So our ask for you, if you're listening, watching this, please advocate to your fellow veterans to let them know that this exists and help us with that suicide prevention and all mental health efforts. Thanks.
Thank you.
Next up, we have our chief engineer. He is a standard pillar at these town hall meetings because our infrastructure is one of the largest challenges that we have. In fact, maybe last month, we had to shut down our OR in the morning because we don't have a humidifier that most hospitals do. And so we're pulling in this cold air from outside as it gets cold in the mornings and heating that, which then takes out the humidity, which then creates an environment in our OR where some of the utensils aren't ready, the room's not ready, and so we had to move some cases. So Mr. Menley and his team are now working on getting a larger system for us to be able to do that. And you might sit here and go, oh my God, how did that not exist? I asked the same question. My team asked the same question. Mr. Menley's asked the same question. So these are the challenges that make us special, Corey, more special than you in Atlanta. And these are the challenges that we're facing every day to help provide a better environment for you.
Thank you for that, Mr. Mentzer. I'm going to talk about a few of our projects. We've got a myriad of projects. I've got my program manager in the back, Mr. Nicholas Thomas, who's overseeing the actual construction program. So we are working to improve the infrastructure, the aesthetic appeal of the site. The bridge has been an eyesore and a problem for everyone. So we are currently at 65% design. We're going to go to 100%. We're currently doing a fire safety design review at this stage. Once we get past this stage, we'll go on to the 95%, then 100, then go into construction. So we're moving this one along as fast as possible so that we can get this bridge replaced, improve the aesthetic appeal, and open up the entrances so that it's easier for individuals to navigate the hospital. Next. That's just a rendering. Next. I have a couple. This is what we're going for, an enclosed bridge. It'll be conditioned, protected from the elements. So, yes. All right, next. We are improving our environment of care. Our current behavioral health unit's been there since 2007. I know because I was the engineer that built that floor. So we're now upgrading that. We're moving that to our 5th floor, and there are new standards for the environment of care to improve the aesthetic appeal and to improve how we can better manage and just see patients, and to improve the home-like appeal of the space as well. So this project is under review. We just got some feedback from the clinicians, and they made it very clear that we want at least a minimum of 30 beds on that floor to accommodate the amount of veterans that we have. So we are working to accommodate that. Next. We've got a myriad of high-tech, high-cost medical device equipment that we are upgrading. We try to be on the cutting edge of everything that we do at the VA. So our upgrading our cath lab is one. This is in progress, and we'll be wrapping up soon. Expanding access. A lot of our veterans love the home-like feel and the aesthetic appeal and just a piece out of our Trinka Davis Veterans Village. So we have 4 pods that house about 10 patients each. We're going to be building a 5th pod because of the popularity of this site, but also we need to open up access for patients to get care here at a VA medical center. So we are in the project planning phases. We're trying to make sure that as we're performing the construction activities, patients have safe egress, ambulance can approach the building, and in the unfortunate event of a fire truck can come to the building. So we just want to make sure that we check all those boxes to make sure that safety is first. So we're going to break ground pretty soon, but we just want to make sure that we're doing it in a safe manner. And I think that's my last project. Oh, I'm sorry, elevators. So we have almost 30 elevators throughout our facility. So we are going through and improving and renovating and refurbishing and updating our controls so that we can continue to transport patients throughout our tower and throughout our campus. We are looking to be completed entirely in December of FY26, and this project is progressing well. This is my last one.
Damien, what's elevator P3 and P4?
Great question. So in our main tower, we have a four bank of elevators, P1, P2, P3, P4. So we've taken down 2 of the 4 to improve those and to improve the controls and the aesthetic appeal.
So this is kind of when you walk right in that front entrance off Claremont, them first set of elevators. The secretary was here. What did he say about the elevators?
I wasn't on the walk.
I wasn't either.
Oh, okay.
My nurse exec, he said, so tell me a little bit about the elevators, because if you've seen them, there's kind of a sign. It's kind of a sign like right here that says like under construction, and it's got like a nice tape on it. So the secretary obviously recognized he's very visual. He said, well, tell us about the elevators. And Dr. Hampton, our nurse exec, who's acting as my deputy director, she said, yeah, that's going to take a year. And he said, what? And she said, yeah, I got to watch the new children's hospital be built in 18 months, changing the direction of traffic, and it's going to take, because of contracting, a full year for us to do this, right? I don't know where the conversation went from there, but having spent enough time with the secretary, I'd like to think that that's on his radar of a challenge we have in the VA is that it takes us so long to do anything. It's entirely out of Damien's control. This is through our contracting process and how long we give these folks to do these projects. So, I'm grateful when we have visitors like this that get a chance to see what's going on in our environment to better understand that. Go ahead, sir.
And I want to defend you on this, and I'm also helping the engineer, being one myself, that it's contracting as well as outside contracting with the health and safety, making sure we hit those engineering wickets, making sure we hit those safety standards that are quintessential. And the fact that these are a lot of very challenging wickets, having been in his shoes, the fact of understanding that it's not just, it's hitting all these safety standards that have to be done through governmental processes outside of in-house stuff that makes these programs so challenging. And the fact that these are very challenging processes and a ground up brand new structures are so much easier than these renovation projects are infinitely more complex. And I cannot express to everyone how much more complicated renovation projects are than ground up new facilities are. And they are so much more challenging than a ground up brand new facility. And I want to applaud our chief engineer in the fact that.
Thank you, sir. Thank you.
Thank you. Appreciate it.
Good afternoon. Ms. Cook said I had 30 seconds, so I'm going to do it in 30 seconds. I'm Shalyn Alexander, supervisory recreation therapist here at Atlanta VA. As you can see, these are pictures of some of our athletes detailing what recreation therapy and creative arts therapy is. We are here to try to promote more engagement and creative arts and recreation therapy national veterans events at the national level. So we have National Veteran Golden Age Games, Wheelchair Games, et cetera, et cetera. There is the list right here and dates as well. If you want more information, please find me in the back or outside and I can give that to you. We are spread out all over some of Atlanta and we're trying to increase access in different areas such as mental health, inpatient, geriatrics, things of that nature. So again, recreation therapy, we put the fun back in therapy, fun back in functional, and we are here and present.
Maybe this is for the engineer, the status of our gym for adaptive sports athletes.
Yeah, Minley, what's the status of the gym for the?
Great.
Is there really fun in therapy? I'm trying to get through the.
Very healthy.
Yes, great question. Since the last meeting that I was given this task and opportunity, I've been meeting with Ms. Willingham. We meet on a bi-weekly basis, and we've looked at different sites, including the gym where they used to be, and the gym that they used to be in is the only area that meets the requirements that they need. So
who's in there now? Pharmacy,
cash, and
oh, that's right.
And canteen.
I remember now.
Veteran canteen. So
I'm sorry.
Yeah. So we're working with through the space committee to try to get that space, sir.
Thank you.
Yes.
Good afternoon, everyone. My name is Dr. Kendra Lee. I'm the Associate Director for Access. Always glad to see you, always glad to be here, and happy holidays. I will be quick and brief, but what I want to share with you guys is, as you can hear, we're making a lot of changes with Access. And my team is here to support our providers and the rest of the facility in doing that. As you heard earlier, it's some of the HAS staff, my staff, that has supported with our gynecology program that we've started, and we're supporting in other areas. So anytime you hear Access, just know there's a team of folks behind that's supporting, and those folks fall under me. With that being said, I do want to share with you our mission. We as a team have come up with a mission to deliver seamless, world-class, coordinated access to care for our veterans by aligning people, processes, and technology. What that means is that's our promise to you. That's what we're working towards. So now that we're coming together as a team, we have community care, we have the business office, HAS, Health Administrative Services, we have our outlying sites of care, and we have our group practice managers. We're coming together to find ways to better support the facility and better support our veterans. Next slide. This is some of the information that was talked about previously as it relates to the 72-hour notification. I won't read the slides. I did provide a lot of information because I want to make sure you have this information, and it is available online and through the slides, so that's why it's there. But what I did want to highlight is, one, we have been hiring. We've increased hiring for HAS by at least 38 FTE, and that's growing. We have 4 new folks in community care, and we at least have 1 more GPM, and we're looking to grow in those teams. What does that mean for you? That means that there's more support behind the scenes to improve the access, to get you those appointments, to answer your calls. So we are working on improving access to care. Next, I wanted to highlight that we have Access Veteran Forums. What is that? That's another town hall, but it's specifically focused on access to care. So that gives you an opportunity to meet with all of my service chiefs, ask them your questions, get more answers. So we will be meeting quarterly, and right now we are at the main campus, and I know that sometimes is a hardship for a lot of folks, but we will be live streaming it, and it's recorded. So if you're not able to make it, you will be able to see those town halls. You'll be able to access the information after that. As I noted before, community care and HAS fall under me. Some of the things that I wanted to highlight is billing. I know, again, billing is an issue. Please call community care if you have questions, if you need additional support, and then make sure you fall within that 72 hours that you're reaching out, because if it's after that time, it makes it much harder for us to be able to support you with those emergency bills. Additionally, I wanted to speak about a lot of the changes that we have for travel. We have a new Arcadia Clinic shuttle schedule, so please be on the lookout for that. And then if you're having any questions or needing support, I know my chief of HAS is here. He can talk about travel. He'll be available either in the back or outside. Next slide. One of the big things that I wanted to share with you is we're looking to reduce our wait times and improve access to appointments. And one of the things that, you can go to the next slide, one of the things that we can ask from our veterans to help us is, if you're not able to attend your appointment, please let us know. You can either call the facility or you can reach out through secure messaging, but give us that opportunity to allow for another veteran to take that slot as soon as possible. And that helps each other, right? We're helping veterans. So that is one of the things that we're asking of you to help us improve the access is, if you're not gonna be able to make it for whatever reason, please let us know so that we can hopefully have enough time to get another veteran in that slot. And this kind of just shows, that impact that it'll have overall. We are the highest. We're at 15% of no-show rates, and so we want to get that down. So your help with that, along with some other things we're doing in the background, should get us in a good spot and, again, open up access for more veterans. So next slide. I think that's the last slide for me. So, Mr. Burt.
Thank you all. I, too, was informed I have 30 seconds. So I'm Michael Burton. I'm your Connected Care Program Manager. How many of you heard of My Healthy Vet or the VA.gov app? For those who haven't, think of Mr. Mentzer and Mr. Hawthorne. Both of their parents said they were special, separated at birth. Mr. Mentzer grew up with providers. Mr. Hawthorne grew up with money. Now their parents said, let's merge together. So now we have one app that's not a reno, as Mr. Menley would discuss. But now this app is one of our robust apps where now your money and your health care is now integrated into one app. This is your splash page that we've never had before. So on here will show you your service status, what service line you serve with, your disability rating, and if you click on show, it will show you if you're 100% or less, and your monthly payment. You never had that type of app access before. I'm gonna show you how this app separates itself from other apps around the nation and inside the VA as well. So within this app, you can have access to go to the next slide, the VA.gov app. So we made it difficult for you though. We made it difficult. But we also talked about a reno versus a new build also. So It is difficult, but under our leadership, under Dr. Hampton, Dr. Singh Anderson, and Mr. Mentzer, we now have a virtual health resource center in which we never had before, where we are assisting veterans one-on-one every single day at the main hospital from hours of 8 to 12, and we'll assist anyone to come in and need assistance with this. It's difficult to do it over the phone, but we will try to support you as much as possible. So this is the My Health Vet Help Desk number in case we're not available. So this number here can also assist you as well. So they made it difficult for you. But if you jump over that hurdle, your next option is your appointment. So you have access to all your VA appointments, all your past appointments and your future appointments. So as Dr. Lee mentioned, if your appointments and you need to cancel those so another veteran can get that appointment, you can do so on the app. So the app is very user-friendly. They change up the graphical user interface. You can see everything. It's user-friendly, clear, color-coordinated. And let's go to the next one. No other app is going to give you your DoD military information. This is going to set us aside from Kaiser, Wellstar, DeKalb Medical, because not only do you have all your VA information from 2013, January 1, 2013, moving forward, but your DoD military information. So when you want to look at what you may have had in the military, the VBA will have that information, but you will have that information. So you don't have to go to medical records and try to download your information. You can download it to your phone, to your PC. You can send it to your outside provider, even though many of our outside providers have access to your records already through the Georgia Health Information Network. But you have access to everything that we have. What we have, you have. What you see, we see. Inside the app, your medication, your past medications, your future medications. As soon as you get your medication, you go into the app and you can renew your medication. It's not going to come the next day, but it's going to trigger the system, which is in CMOP, that you're close to your medication being renewed, and it will send it out. You can do all this on the app. Secure messaging. If you need access to one of these thousands of new hires or existing staff that we have, you can send us messages. The beauty of secure messages versus a phone, and Mr. Mentzer can attest to this, we have to report on these messages every single day. He don't let a day go by. He's big on accountability. So, and he's not only a client, but he's a secure messaging user as well. So we can't delete messages. So if you need to reference a message, you can gain access to that. National don't delete messages. The messages will stay in your inbox for 14 months. After that, they're purged to the national database. So you will have access to that, and we're giving you access to thousands of staff members that you can't do over phone. You're not going to call pharmacy over the phone and then try to call primary care and try to call your specialty. You can do all that within a day. You can just start sending messages to get your health care taken care of. And that's it for me. Thank you. Oh, okay.
Go for it.
Back up like 4 pages. Right?
Four pages?
Yes, at least. 2, 3, 4, 1 more.
Right there. Okay. So, okay, good.
So this, God, there was another hand up. Go ahead. No. Yeah, go ahead.
I just wanted to know, how do you download the app?
So just go to the App Store, and it's just a VA logo. It's a blue tile with the letter VA. I pulled up my phone just to make sure because I was gonna. It is phenomenal. It is what we've asked for as veterans forever, and it's finally here. My stepdad didn't have it, and I was like, Mom, you got to get this. Like, you got to get this app. It'll change your life. So you can track your records through the VBA and what's going on. It's beautiful. Go ahead.
Okay. He said something about veterans that need in-person help, and
Yes.
it's over at the main clinic, but where at? And
As soon as you walk in, you go to the right to the Welcome Center.
Oh, where it used to be the Learning Center?
Yes.
Okay, and what were the hours?
8 to 12.
Okay, I like to be able to share that with other veterans.
Yes, thank you.
Thank you.
Thank you. Yeah. I don't remember signing on. I do remember being difficult, but now that I'm in it, it just recognizes my face and just comes up instantly every time. So I absolutely love it. Go ahead. What's your question? Go ahead. Give it to me.
I got a question and I got a dilemma.
Okay.
Okay,
Well, the dilemma's not being an Falcons fan, is it?
No, they ain't worth 2 dead flies.
Okay.
I just got this on because I'm head coach. Don't get it twisted. Okay, my problem is I am very, very glad I have just great news for the VA. I've had 7 surgeries and 13 procedures here. I'm 75 years old. I've never, ever had a problem with the VA, never. Because my primary care I've had since 2010. I'm a GI doctor I've been had for 9, 10 years.
You've had the same primary care provider since 2000?
Since
Wow.
2010. Yes. And yeah, doctor.
That's what I asked, to be
I'm
clear.
on the gold team. Same
Okay.
thing.
Outstanding.
The problem is I go out, I have a herniated disc in
Uh-huh.
my back,
Mhm.
and I go out for
Mhm.
community care.
Yes, sir.
For the VA, through the VA, and I have I've been going, and I haven't had any problems. But now, when I sent something back to my, you have after your 15 visits are over, you have to send in for renewal, and it has to go through physical therapy here at the VA. But it's been stuck in physical therapy at the VA since September.
Okay. That's too long.
I've never been able to go out, and they're saying that I don't need any more visits. How you gonna tell me what I need and what I don't need? And I'm 75. My bones ain't getting stronger. You know what I'm saying? So the dilemma is, how do I get this process that's stuck at the VA in physical therapy, where it can go on out to community care, where I can go and get my 15 visits, where I can go and start back in community care.
Yeah, I don't know that answer for you, but I'm sure we've got.
Somebody here that knows?
Yes, yeah, we've got somebody here that can help you with. We've got we've got a fellow veteran here that's got maybe a question or not to help. But she can probably help, and then we've got a gentleman right here with the Yankees hat on, the only one with a Yankees hat. It's a winning team back there. He can help you with a solution. Yeah, there you go. All right, so I'm going to give it to Miss CDCE, our voluntary service specialist, Chief, to share.
All right. Hi, I'm Gwendolyn Ramos, the Chief of CDCE. That stands for Center for Development and Civic Engagement, formerly known as Voluntary Services. I just wanted to highlight a few things that Voluntary Services CDCE has done over the past few months, mainly December. We have Cobb VA Clinic has a mobile food drive, so if you're interested in learning more about the food drive over at the Cobb Medical Specialty Clinic, please reach out to me and I will give you those dates of availability of when you can go in and receive those foods. We also have an Atlanta military veteran food distribution. It used to be called the mobile food distribution. Over here at the AVC, we have it monthly. It's the third Friday of the month from 9 to 2. If you're interested in knowing anything about that or being a part of that, please reach out to your social work service line. Your social worker can sign you up to receive those benefits. Santa and Miss Claus will be here on December the 15th. If you want to come out and see Santa, he will be here seeing the patients on the floor, visiting. Our Adopt a Veteran program is December the 15th through the 19th. We've already received those veterans, families that needed to be adopted, so we will be delivering those gifts between those dates. Stocking distribution is the 15th through the 19th. So if you're at the facility, you don't have to be an inpatient. We received over 1,000 stockings and gift bags, so we will be delivering stockings that week. Turkey and ham giveaway, December the 22nd. We will be giving out hams, but this time we are asking the different VA clinics to provide us with the names of the veterans so that we can give them intentional to those that are in need. Now, DAV program. Our DAV program, we have a Gainesville DAV van that is operational on Tuesdays. If you are interested or you need a ride to the VA clinics, please reach out to my office at 404-728-7728, and we will give you more information. We are actively recruiting for volunteers. If you are interested in helping out with our volunteers and becoming a volunteer to help your fellow veterans, I think they cut me off. Please reach out to my office so we can tell you about the opportunities to assist your fellow veterans. The other van is in the Covington, at the Covington VA Clinic. If you need a ride to the for appointments, please reach out so we can give you those dates and times where you can catch those vans for your appointments. And that's all I have.
Go ahead.
Okay, those are at the main VA. I do apologize. Santa and Mrs. Claus will be at the main VA on Claremont Road. Adopt a Veteran is also there. Stocking distribution is there. Now the ham and turkey giveaway, that will be strategically planned. Okay, you're welcome.
All right, Q&A. Look, I know it's been a while, and I'll get to both of you. It's just there's so much information to share, and I really don't know where to stop and draw that line. So everything that we share has been asked of us at some point in time. And so how do we get it out to as many folks as possible? So we will hang out with you for questions until we've answered all of them. Do you mind if I do ladies first?
My name is Carrie, and I served in the Army.
Cool.
My question is something like what Anita's doing. I live over in the Union City area, so I serve at Fort Mac. There's a gym or a room over in the back of the domiciliary. Yes, I can come out here, but there are other veterans that's in the program that don't come out here. And I'm asking if we could have access, or how do we go about getting access to that gym over there? Because our recreational therapists, they always going to community places trying to find out for a place for us to go, so when there's one at Fort Mac, let's try to get it implemented so that we can.
Okay.
Yeah.
Yeah. Okay. You're working with Mr. Minley?
Yes, sir.
Thank you for that. Thank you so much. That's a big
Thank you.
task. Go ahead, sir.
I had a quick question. Sometimes I guess we assume that everybody has a stove, access to a stove to cook these turkeys and hams, and we give them away, but I don't know, and it's a good gesture, and it's always a good gesture, but sometimes we overlook that. I just saw
That's an
somebody
interesting
express
statement,
that
yeah.
not this year probably wouldn't be able to do it for the VA, but maybe a facility
Good
that
point.
would say, I cook this turkey, I cook this ham for the people that get it because they don't have the stove, or maybe not able to lift the
Yeah.
turkey
I love
or
it.
ham.
Thanks.
Okay.
It's a good point. Great point for us. Yeah.
So my question is about the going out to the different places that we do go to, recreation, whatever. There are not enough recreational therapists because they are so few of them, but the different places that we go to are so spread out that if I show up to quote unquote an appointment and the recreational therapist is not there to verify that I was there, I can't get travel pay or anything for going there.
Mhm.
So, because like I said, the recreational therapist that I was associated with, it just left and moved back to Fayetteville for family reasons. But now the recreational therapists that are left are not able to go to the different places because they may have stuff 2-3 different places on a Tuesday. And so one of us is not
Yeah.
being able to
Get coverage. Get the
get
support.
coverage to show that we were there. Even if I call them and tell them, well, I wasn't there, so I
Okay.
can't even put a note in, So
Okay.
how,
That's not an answer, but it is a statement, and we'll take that back to work on it.
okay.
Yeah, definitely. Thank you.
I'm a veteran, Army veteran too.
Cool.
And my dilemma is, and I apologize for speaking with this mask on. I came to the dental clinic last year, and I've been trying to have a meeting with you for over a year, but they won't let me.
Okay.
I got approved to go out into the community for all on 4 implants. Okay, I went out to the community. They took the x-rays. They did everything. I went back. They pulled my teeth on March 28th of last year. So I go back in April 9th, 10th to get the screws put in. And Julie Comer, the acting director, decided to cancel the approved implant plan.
Okay.
Now I'm 43 years old, sir, and I don't have any teeth in my mouth. and I haven't had any teeth in my mouth for 2 years.
Oh,
I suffer from agoraphobia, and I specifically told them when we were discussing my treatment plan that I'm trying to get acclimated back into the community. I don't know if anybody's aware of what agoraphobia is, but it's been hard for me to even sit in this meeting. So when they took my teeth, I can't go to any family dinners, Thanksgiving, Christmas. I've been in the house for 2 years stuck because I'm ashamed to go out because I don't have any teeth in my mouth and I'm disfigured, and my speech has been impaired.
okay.
Now, what I don't understand, because when I wrote into you all took it as an appeal, that I was appealing their decision to not give me implants. I had teeth in my mouth. If I was given the choice and they said, hey, the only thing that we're going to approve is dentures, I would have chose to keep my teeth. So my question to you is, sir, I wrote into you and you said you and your chief of staff, Robert Novo, reviewed my case and reviewed the directors and that my appeal was denied. I'm not appealing anything. I want to know, how is it that you can sign up and tell us to go into the community for one thing, you pull my teeth, take my choice away, and then tell me, and you you just change the plan on me. Then they didn't even have the decency to call me to tell me that they changed the plan. They called the outside dentist and told him. So for 2 years, I've been fighting to get teeth in my mouth, and nobody wants to listen to me. They even paid for the implants. They paid for them. Didn't even ask this man, the dentist, for the money back. I had to file a fraud claim in order for the VA to investigate it to get the money back that they had already paid him to put the implants in. So I don't mean to get emotional. I'm not going to keep up your time.
No, that's all
But
right.
my
I
question is,
appreciate you bringing it up. I hear your
need
question. It's like 5 different questions, and I think all 5 are valid. One is, I'm sorry. Right. I mean, I have to be. I mean, that's pretty crappy. Apologize that that's where you're at. 2 is, let us fix it. We have a new chief of our dental service, and she's phenomenal. We've also got, this is an example of some of the challenges that we have in the government right now. We also hired a dentist to work in the community care department. Community care is almost all admin. Now we have nurses out there, but their job is to administratively review the records as a clinician. It's an admin service. But we hired a dentist because we were sending so many veterans to the community and we were being robbed. So I myself just got care in the community as a veteran in dental 2 weeks ago. It was phenomenal, right? And in the private sector, when you normally get the care every 6 months, you get your cleaning. And I said, well, do you want me to schedule the cleaning? And they said, well, you've only got a consult for one time, right? Well, I came back and I talked to Dr. Norvell, my chief of staff, and he's like, yeah, that's because when we send it out any other way, there's a large chance that the community provider will misunderstand that and give you care that's not going to be paid for by the VA, right? And we're trying to bring you back inside. We're trying to hire dentists to get the care inside so this kind of thing doesn't happen. So he said, what I need you to do is talk to your primary care provider when it comes time for another cleaning and then work through at that time, because we might have a dentist on site that can do it for you, right? Because when I got my care here, x-rays, they did the exam, and then they said, well, we don't do cleanings, we're going to send you out. Within 2 weeks, I went out, got my cleaning, x-rays, they did the exam. I'm thinking, man, it was a bunch of wasted money. That's because they want to protect themselves and they want that money. So we've got an issue with our dental providers in the community and making sure they follow the recipe we've given them to provide care for you. It doesn't mean anything that sounds like you went through is excusable, right? So let us work with you specifically this afternoon to make sure that we can get you something from our dental program. We have a really good chief of dental right now. I'd love for her to stay with the VA for as long as she'll give us, but sorry about that. Yeah. And it's okay to get emotional. I'm okay. Yeah, that's all right.
Yes. It is apparent. I think it is. Do we have a new scheduling department? Because I've had massive calls to schedule appointments, which is a good thing. But at the same time, when I ask questions, they say we're in scheduling. We have nothing to do with the department, and that is good in essence of I'm getting scheduled to either have an appointment or they send it to community care because of the time gap. The problem is, and I don't know if anybody's here from community care, but I had to go to advocacy, and advocacy kind of triggered the switch for people to start calling me from community care. I got one call. I had vascular, dental, physical therapy. I told them everywhere I wanted to go because I knew of the places because I've been there before to make the job easier. I've gotten set up with my vascular on the outside. My dentist called me saying, I got a message from advocacy that something's going on with your dental care. She put in the paperwork in October. It is now December. She called me before Thanksgiving to ask me what was the problem. And I told her, I said, the problem is not with you. I'm not hearing from the other end for dental. And I have 2 procedures I need to get done before I can get a guard for my mouth for sleep. Or, well, TMJ.
I thought you were going to say TMI.
No, TMJ. So there's a hang up. I had one of my doctors look at all my records. They say everything's out there, but it's not getting processed through community care. I think it's been processed, but I'm not getting the call saying you're authorized.
We'll work on that. You're right. It takes us how many days on average right now in community care? What's the overall average? She said 2 weeks on average to make that call. So she'll follow up to see where we're at. This is Kendra Lee. She spoke a little bit. AD over Access has that community care department. So to answer your first question, we did not get a new HAS. What we got was new leadership. So Miss Lee's been with us for a year now, and Mr. Dumas in the back's been with us for a year, the chief of HAS. And with that new leadership comes new accountability.
So we do have a scheduling department for appointments now.
So we have
separate.
Yes. So
Okay.
I take this for granted because it's my 5th VA, and a scheduling department is standard in most VAs. But when I came to Atlanta, that's very special. It wasn't standard.
Right.
Right. And so now we've standardized it to say, look, we're not going to be unique in that way. We're going to have a department that does the scheduling. We call it the patient scheduling clinic center.
And I think it's important for the veterans to know that because I didn't know who I was talking to. I appreciate them.
Yeah.
But I was confused.
It's one of the buttons when you call into the main line now. I'm not sure which the extension is, but now as Mr. Bruton shared that we look every day at the My Healthy Vet. We look every day at the call dropped rate. We look at how long it takes to answer those calls. We see a challenge in community care, and it's because we don't have enough staff to answer the number of calls that come in every day. Where we get a better return is the My Healthy Vet. If you use the My Healthy Vet system, we're getting a better return rate. It doesn't mean a call is not acceptable. It just means we don't have the resources yet to provide that. It's like a third of the calls are like, I'm waiting too long, I'm going to leave. And we want to get better. Our goal is to be less than 5%. We're at 5% in the facility, but we're not there with community care yet. But it's too long for us to schedule in community care. We need to do better.
Okay. And then the other referral was for podiatry. That was triggered. End up having the department, the head of the AVC called me, which I appreciate, to get that appointment straightened out. There was a problem with admin type things happening there. What I don't understand is if I have an ongoing requirement for foot inserts and I go to prosthetics to get them, if I miss 1 year of picking up those inserts, I have to go to podiatry. To me, if the inserts are working, I don't need to see a podiatrist. They've already put me in for that, unless there is a requirement. I feel like I'm taking up another appointment where somebody else could use. All I need is my inserts, and they're custom inserts. My feet haven't changed. I would complain if I needed new inserts, that are not working. The ones that are not working. So I don't understand. There seems to be some kind of thing going on.
There's a disconnect there because my stepdad gets care in prosthetics, and they had an issue with getting shoes. And there's some value to being the director of a VA, so I have resources. So I reached out to my team who said, yeah, you get 2 pairs of shoes a year. So I was able to give them the directive to help them. So we can probably help with our prosthetics and our podiatry department to make sure. My guess as a non-clinician is they want to make sure that the inserts they're giving you, like nothing's changed with your feet from 365 days ago to now, but we can let them clinically provide a response to that.
Okay, all right.
Yeah.
Apparently, the doctors have an issue too, because every time you mention, I have had 4 doctors, primary care, and every time you mention podiatry, it's a frown.
Yes.
You know what I'm talking
Yeah.
about, because I can't be the only one having that issue.
Yeah.
Thank
We'll
you.
work on it.
Thank you so much.
You're welcome. Go ahead. We've got a visual aid.
I'm getting old, so I have to have notes. I got an encouragement from employees to bring this to your attention, and it's something that's affected me, which is our sleep center clinic.
Okay.
And the problem area it starts with is the schedulers. They could do outbound calls, but when you talk to the employees, they cannot take an inbound. When you do get a voicemail from the scheduler, they'll leave a number. When you call that number, it's a dead end number or it just rings. And it's not happening across all the clinics. It happens in this particular area. And when I've talked to your employees about it, they're aware of it. They say that's a problem. And I said, well, how come we can't fix it?
Yeah. What are we doing about it since you know about it?
So go to Kai and throw
That's
this out.
not the answer, but it is a answer. The answer is that, they didn't let us know.
So, and then I'll give you a little bit more in this whole process. That led to about 8 to 12 weeks of going back to advocacy to try to get the scheduler even a time slot to call me so I could be there to answer. That didn't work. After that, I finally said, enough, let's go to community care. So now I go out to community care. So what would have cost us a few $100s is now $2,300 to go out in community care to get a sleep test done. Now, after you get done with that, your community care doc writes the script. It's for CPAP. So you come back into the VA system. Nobody's told you how to navigate that part.
Yeah.
Don't take it to pharmacy. That's not where it goes. Pharmacy will puke. Then they'll turn around and throw you over to the place where we have all the prosthetics.
Yeah.
They're not the right place. It ends up coming back to the sleep clinic. Now you have to somehow get scheduled in a sleep clinic, but you can't do that. There's no communication with them. Back to the schedulers. Eventually, that just led to advocacy of me just coming over and pounding on the doors. So now we're at this point, and now they say at the sleep clinic, you can't get a CPAP machine until we have an orientation with you. 6 more weeks. So I've been in this thing for 6 months. After you get the CPAP machine, now you have to adjust the face mask. And because I have a large face, none of those will work. So that's ended up back and forth in advocacy until eventually the supervisor called me and spent probably an hour on the phone. We come up with a plan. But it just seems to me that we're trying to build these into centers of excellence.
Yeah.
And we're a long ways
that's,
away from
that's a
that.
far ways off.
But I think the bigger area right now to fix is just get those schedulers. And what I've been told is these particular schedulers are in an offsite place somewhere. And the phone system doesn't work.
So thank you for bringing that up. I do want to let you know we are aware and we have put in IT tickets to adjust and address those issues. We're also working with our service lines to make sure that we have the correct information for all of our phone lines, and we have an audited process that we'll be putting in place to ensure that we're checking those on a regular basis. And then lastly, what we're doing is we're getting business cards for our MSAs. So when you go to the front desk and you meet someone and you're working together on your schedule and what you're moving forward with, they can provide you their number as well as an extension and let you know when they'll be there to make it easier for you to continue to contact that person, because they know your situation and they know where you're going. So that's going to be a start. It won't be the end all, but it's what we're working on right now. And then, yes, sir.
One more thing. If you're coming in from community care with a script in your hand, why do we have to wait for orientation? Why can't they place the order? And this goes to the Denver Logistics Center. Why don't they just place the order, let that get in shipment, and then go ahead and proactively get that orientation?
So for the pharmacy?
Well, it's not pharmacy. The problem.
Oh, for the
It's
CPAP. Okay.
Prosthetics. So prosthetics, but it's outside of prosthetics because it ends up going to what's called the DLC. So why can't we just go ahead when a patient comes in with a script in their hand, place the order, and then at the same time, place an orientation call?
So I'll have to look into that and we can follow back up on that for our next.
I need all the notes.
Oh, thank you.
Sorry.
I will look into that, and then we can follow up with you. We'll make sure we get your information, so then we can give you some more information. Thank you.
Bob's a frequent flyer for us. Rightfully so, though. I mean, good concerns. I don't know the answer to that one either, Bob. Most medicine stuff we're fine with, but the CPAP's a little bit unique for us. Thanks. Push it to the right a little bit. Yeah, you.
Hi, Mr. Mentzer.
Hey, how are you?
I'm good. So I have a question about the environmental services for the VA campuses here in Atlanta,
Okay.
especially
Like housekeeping, cleanliness,
recycling. And
recycling. Okay.
composting, because we have food scraps and all that in the
Uh-huh.
cafeteria. That stuff doesn't seem like it's a big issue as far as environmentally, but it is
Okay.
due to like with the lab, lots of plastic film around the tubes, which have the styrofoam that they're packaged in. Styrofoam is actually recyclable
Okay.
at the Center for Hard to Recycle Materials.
Mhm.
And so I, being the veteran and former ambassador that I am, I would collect a recycling container
Oh,
over the
that's
past
cool.
like 6-7 months, and 5 days worth of plastic films, styrofoam coolers, the whole 9 yards, cardboard.
I
know,
see one of my interns in the back.
know this about me. Yep, resident environmental educator and whatnot. And the environmental impact was great, even with just the small portion that I was getting from lab, maybe sometimes prosthetics, front
Mhm.
desk at Claremont, things like that. And then coffee cups, those lids are number 6 plastic. I've been doing this for a while, but yeah, that stuff adds up by the second when you have a building. When you have like State Farm or Ben Stadium, those are also big, massive buildings, obviously, with lots of what's it called? I just didn't know, offhand, off topic, kind of aside from all this, what sort of plan of action can be put into play? Because that
Yeah, I was waiting for the question because I didn't want to answer the wrong.
Okay.
My director was just in the room. He brought this up to me a couple months ago, actually, to work on it, was talking about it with his EMS department. I don't know the outcome of it, but I know that they're working on some recycling program for us because it was something that he actually noticed as well, is that we don't have a lot of recycling containers. So, yeah, so we'll work through that. Yeah, thanks. Sorry, my mic is coming and going.
How you doing, Mr. Misner? So my question is about the recreational therapy and adaptive sports program. Many times I come across veterans and I'm telling them about the national programs that the VA has, wheelchair games, veteran, and they say, I don't know anything about that. How do I get involved? And my answer is, well, I'm telling you.
Thank you.
But I'm sure there's a process to get new veterans and current veterans involved in the adaptive sports and the recreational therapy program.
Yes.
What is that?
So it's expected in the VA. One is for the folks that help you guys every day, all day long, to be able to advocate for their program with the providers. So meeting with our primary care team to give them some flyers, some information. So that's one thing that maybe I need to look at to make sure we're doing with your team that helps you all the time. The other thing is, I know we send out message regularly, so maybe we can bump that up a little bit to speak to the veterans. But I know a number of veterans that just ignore all my emails, so we can try. But the real answer is you guys. It's us veterans talking to other veterans about all the resources that exist. That there's 9.9 million veterans that we provide care to in the VA. That's 9.9 million mouths of sharing this story of what exists. To other veterans. So that's the best way to do it. But, maybe we could do some more internally to help support.
Speaking on that, I spoke with Dr. Pittman earlier that there's lots of lost opportunities. I was just at a clinic this week where it looks like the VA had prepared these clear things where you're supposed to be putting a flyer or something on.
Yeah.
It's been that way for 3 months now. And veterans sit there and that we could have
There's nothing there.
games, wheelchair games. And this is a clinic that treats amputees, so they would have been interested in the wheelchair games.
I agree.
In the laboratory, you sit there for 45 minutes to an hour, right, for labs, and we could have stuff posted about everything we talked about today. With the pharmacy, we could have everything posted on the walls. That's where we're sitting.
What clinic was this?
This is Claremont.
Okay. We'll have.
I've got the picture.
Okay. Thanks.
Good.
Okay.
Good afternoon.
Good afternoon.
And I'm Army all the way.
but I'm also a former Army chaplain. And so I've been feeling this place for a long time as a veteran and have done training here in your CPE program that you
Oh,
used to
wow.
have here. But that was many, many years ago.
Yeah.
What I want to share with you is some confusion having to do with fraud, waste, and abuse. I went to the sleep clinic, had everything done, everything squared away, and hey, the diagnosis, you have sleep apnea. Oh, okay, I didn't know this. This was from blah, 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 blah. Went to went to have it, squared away to get in my records, only to be told, well, you need another sleep apnea test. And I'm saying that doesn't make any sense. That's from a second party. And besides, the VA, they've already done it. It's already been proven. It's in my records. No, 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 no. You need another one. So I ended up going hither and yonder, Dale, and the nurse asked the same exact questions, all the procedures that I had here at the VA. She said, hey, doing the same thing. And I'm saying, well, why are you doing the same thing
Yeah.
that they did at the VA?
Yeah.
And she says, well, I can't tell you that. I'm
Yeah.
just, part of the
So my
the
dentist said at the
system.
community.
And
Yeah.
by the way, I'm hired by the VA. And
Yeah.
that doesn't make any sense.
Yeah.
Came back, and then my claim was denied. And I'm saying, wait, this doesn't make sense. I mean, but that's just one thing
Okay.
that I would say.
Yeah.
You
Thanks.
need to check up on that. It's ridiculous that you guys are being cheated out of your money, in my particular opinion, and particularly when you yourselves, the people and the practitioners here, said that yes, this falls under the PAC, blah 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 blah, and then another entity does the same exact thing you did.
Yeah.
And
we paid
boom.
them. Yeah. Thanks. Thanks for sharing that.
And also just with another one, and again, it may affect other people. I'm told about getting, normal appointment. Okay, normal appointment, CT, get also something with my eyes. I'm told, well, if we do it with the VA, it'll take you 8 months to get an appointment. And I said, are you crazy? This is just something so so simple that it shouldn't take that long in terms of scheduling, etc. I
It
can
does.
be patient and work, but in the meantime, things could be going on,
Yeah.
with me that further deteriorates.
Did they offer you to go to the community?
Uh, I'm glad you said that.
Yeah.
They did.
They did.
And guess what?
Huh.
Community will call you.
Yeah. Yeah.
And I kept calling,
Yeah.
back,
I know.
and it was, you need to wait.
Yeah.
Community will call you. And I'm just saying, it's small things like that
Thanks for sharing.
that causes
Yeah.
stress. For me, it causes stress, even though I'm a chaplain, caused me a little anger.
Mm-hmm.
It also makes me feel, well, if you're doing this to me, how many other
Mm-hmm.
veterans are you jerking over? And that really
Yeah.
upsets me.
Yeah.
So what I'm saying with your system, there needs to be more accountability. and people looking around.
I
And
agree.
there's sometimes folk don't want to go fighting with all of these different entities to find out what's going on.
I agree.
So I just want to bring that
Thanks.
again to your attention and hit hard. It's not enough to say, oh, we're sorry. Oh,
I agree.
what can we do?
I agree.
Let's get some action on that.
Yeah.
For every veteran.
We're working on it. I mean, I'm definitely working on action and accountability. Yeah. Yeah. I'll tell you that I'm not going to change it overnight. And here's what I'll tell you about the access. Here's what I'm going to tell you about the access. Our wait times are so long because you keep choosing to come to us. Why do you choose to come to us? Because you know in the community, it's the same. And so we're in this together, right? We're in this together. As a community, we need to fix healthcare in Atlanta, right? I'm so glad that they said, do you want to go to the community? And I know that the community has the same challenges we do, but my job, according to the law, is to offer that to you, right? Senator Ossoff used to ask us, what are you doing to fix the community? I don't know. I mean, I wish I could, but I can't hold them accountable to be timely with the care either. It doesn't give me an excuse that we have wait times that are so far out. But as I started, I'm hiring as fast as I can to improve the care as fast as I can. It's just an insurmountable challenge. It doesn't mean, right, that we should provide that inadequate care that you just described. So if you'd let us work on that in your specific situation. And I know that it's not just you, because I agree, it's the rest of the veterans that don't come to the town hall that also you're advocating for. And I really appreciate that too. Yeah. Yeah. I just want to, I'm trying, accountability isn't firing everybody. Right? Because then you've got nothing. Right? Accountability is ownership and results. Great. You owned it, but if you're not getting results, if you're not making a difference, then you're not really accountable for it. Right? Yeah. Thanks. Chanel said there's 3 questions online. I just want to look at maybe 1 or 2 of those real quick before I know we're getting late in the day. The sun is getting low. Go ahead.
I'm on the phone. Am I able to ask a question?
Yes, go ahead.
So my question is in regards to community care. So it's really neither veteran or provider friendly. I've had several instances where I was sent out and just the request for services, for instance, I was sent out for orthopedics after I tore my ACL and had surgery. They ordered physical therapy. I was doing the physical therapy and the visits ran out, but of course my recovery was not complete. And it literally took 6 weeks to get a renewal in the middle of, my recovery. And that required hours on the phone and then also involving the patient advocate to just get, simple services renewed. So what is being done to make this process easier for both the veteran and also the providers? Because as it stands now, it's not. And in that instance in particular, it went back to my primary care doctor who hadn't been involved at all, nor had I seen him in 6 months. And then it went to the orthopedics department at the VA. It just was round and round. And there needs to be a better system in place.
I agree. Thank you for that question. Thank you for bringing that up. We do have a cumbersome process in place. Some of it is our requirements and things that we're required to follow. What we would like to do is to get with you specifically about your concern. And so I'll work with the team to make sure we're able to get your information. So I can reach out to you and have my team reach out to you about your specific concern and we can find a solution moving forward. So thank you for letting us know. Okay, and our community care chief is online. She has been responding, but again, we'll make sure we get your information so that we can follow back up with you specifically. Thank you for that.
Hello?
Go ahead. Go ahead, sir.
Yeah, I'm U.S. Army Robert Dickerson. I'm not really on the medical side of things, but I've been trying to get hired in the environmental services. I've submitted the application when y'all were hiring in the Atlanta area, in a few clinics in where I live at, Stockbridge and Pikes County. And every time I call there, or the number that they gave me to point of contact for the job,
Hey, sir.
nobody never answers.
Hey, sir, give me your name.
Robert Dickerson.
Robert Dickerson. All right, we have your number. We'll write it down and give you a call.
Please do, sir, because I'm good in that area.
Anybody else want a job? Thank you, Robert. We'll give you a call. We have a question in the room. Go ahead, sir.
Good afternoon. Good afternoon.
Good afternoon.
My name is Sam Russell, United States Navy.
One other.
One team, one fight. The warfighter. Hopefully I got an easy question. If you're traveling outside of the country and you get sick or injured, are there VA benefits available for that?
When I travel outside the country, there's nothing available for me. I've gotten sick a number of times when I leave on vacation because I have 2 kids. I think the answer is no to that.
I can give you some answers.
Like the U.S. Virgin Islands, yes, but I think that's different.
I'll hit you up after.
Yeah.
I got some
Yeah.
tricks.
Which country?
Well, I've been to 24
Oh,
countries
well, then,
already.
yeah. I knew there's probably no. Yeah. Thank you. That was a good question. Go ahead. Hey, good to see you.
Hi. So mine, it's going to end with a question. So I tripped down our stairs in August on the 30th, and was taken to the urgent care because I fractured my ankle and tore and sprained my knee on my right side. So my left foot, my right side. And so I saw a podiatrist in West Cobb, and she, put me in a boot, the whole 9 yard. And she suggested a knee scooter because I had surgery on my wrist and the crutches was actually impacting the healing process. Long story short, that was August the 30th. I didn't get a knee scooter until November. And when I did get a knee scooter, I didn't get just one, I got 3. And when I got the 3, it was because I had to go down to the Claremont location for an appointment with PMR. And while I was there, I went across the hall and I said, and this was the end of October, and I said, well, I don't know what the holdup is. The young lady at the window, she said, she called. I stood there, she called, and they said, well, it's here at FedEx. We don't know why it's just sitting here. And she says, and they had sent me an ankle brace to sleep in. And I got that. And she was like, well, the 2 were together. I don't know why one came in, the other one didn't. So she says, we're going to drop it in the mail. 7 days later, no knee scooter. And so I was down at I was at here and I just drove over there and I went to patient advocate and I said, you know what, at this point, I think I'm just going to go see Mr. Mentzer. And he said, oh, no. He said, we'll take care of you. He was like, no, we'll take care of you. And I said, okay. And so he called and all of the dots connected to this because I couldn't get in touch with my primary care. I couldn't get in touch with ortho. I couldn't get in touch with prosthetics. And then all of a sudden, everybody started calling me. And like I said, within a week, I ended up with 3 knee scooters at my house. And so when I went to the physical therapy at Cobb, I took one there and I said, I really don't need one. And he was like, well, I don't know what to do. Because I said, I don't know what to do with 3 of them. I said, I only need one. And I said, I can dress them up and use them. Yeah. I was like, I don't know. And so I said, and I jokingly I said, well, what should I do? Like sell them on eBay or Facebook Market? I was like, I don't know. And he was like, yeah, do whatever you want to with them. But for me, I just felt like
it was such a misappropriation of funds. Like that's 3 knee scooters that were sitting in my living room for 2 weeks until I just took one. And there's one in the back of my car if anybody needs a knee scooter. I'm just saying.
I know we won't take them back because of infection control.
They're in
like
knee,
a knee
scooter. They look like they're little bicycles.
knee. Yeah. So the moral of the story is if you drop my name, you'll get 3 of it. So, new car. You'll get action too. Yeah.
Mine is a follow-up to Miss Anita Willingham's statement earlier about adaptive sports, sports for vets, all that. I came back from the war in 2006. I was an athlete before I was deployed. I had a real hard time transitioning when I got back from the war. I didn't find out about adaptive sports, national veterans, Golden Age Games, national veterans sports clinics until 2 years ago. So that was 18 years. I could have been a lot healthier veteran. I found out about it through Blaze Sports. There's a Blaze Sports and Sports for Vets on our VA emails that I get. And then I connected with Miss Anita, who connected me with other activities. But I shouldn't have had to wait 18 years to choose a healthier lifestyle. I think a lot of us veterans would be healthier if we had access. And like I said, that waiting room, I could have seen that poster that said National Golden Age Games or Winter Sports Clinic, Summer Sports Clinic. It's wasted opportunity to reach vets.
I'm glad you brought that up again. We're working on a digital version of that. Chanel and her team are working on, every clinic. Well, the ones I've been to, the TVs are broken, but every clinic should have a TV, and in that clinic, we're working on having stuff pop up there to educate and inform, kind of like the Army News Network, or the what we had when I was in Afghanistan.
Right.
And then we're going to have something similar in the break rooms, so that'll help us get that message out on a TV. So we're going to work on rolling that out this year. It's going to be a good bit of money, but we're going to try and get it implemented this year, just because, having the news on there, people complain, well, it's not Fox News. No, it's not CNN. No, it's not AFN. No, it's not. And so we're going to try and put some education out there to help, serve our patients.
The initial gym question that came up 3 months ago, because that's where we could train for our Golden Age Games. We used to be able to train there. Now we've lost that. I'm sorry, but you really didn't answer the question on, you said, well, we're working on it. That's not saying when will it become available to us to use.
Yeah, Manly, when are you going to give them a gym?
And staff used to use it too. Staff used to use it for their health.
Yeah. Minley was one of those staff members that used to use it. He asked me early on, can I get a gym?
So there is a process. We're going to try to expedite it as much.
Look, we got to figure out where to store these meds. Right? This is like, well.
So we try to find other space, but Ms. Willingham told me the spaces that we looked at, that they wouldn't work. So
we need to advocate for more space. That's what we need.
Well, you have those temporary buildings, can't you?
No, we have to get rid of them.
Yeah.
I know. The law. I know. I wish we had better. Yeah. I can't. I know.
Why did y'all decide to use a gymnasium, which is for veterans, or pharmacy drugs in the first place? That's where did that?
I don't know.
So my best guess is, many years ago, we had a CLC, pharmacy cash used to be in the basement.
The nursing homes they tore down.
And we tore it down, and so we lost that space. So, but I wasn't here when it happened.
But yeah.
Well, we'll let you slide on that one.
We'll continue to work on it, though. Yeah. Go ahead, Greg.
6 months to the games, I'm just saying.
Yes, Ms. Willingham told me. And, yes.
And I'm Allison Travis, so Ms. Willingham and Ms. Travis will be happy.
Yes.
Good day, sir. Craig DeLeo, Navy Corpsman. I actually, for those that are Navy, I spent my time with the Navy Palmies. So I did medicine as well as operations. And I'm actually going to start by hopefully changing the tone a little bit. And I'm actually going to look at the VA staff, not being part of the VA, but I'm former Fed. And I want to thank the staff for spending the time here. And for those of us who don't understand, these guys are taking a lot of time to be here with us and spend the time here with us and listening to us. And I will point out, and this is part of my question, is the fact of these guys are doing a lot with budgets and money that aren't there. And the fact of, if for those of you that don't know, we have a ratio for our medical providers. And if you don't know, many of our providers are running at 4,200 here in the VA, are running at 4,200 patients. And if you don't know, that's double ratio. And I'm going to let the director speak to this nature, is the fact of we're running at double ratio. And this is where we need to get on our political providers. And I say this as being one of those people that's heading that way. And the fact of these folks are doing their best they can. And we as the veterans need to look at these guys. And I was speaking to the director before our meeting, the fact of with a lot of our problems is the fact that we're having these problems and what they're doing to try to solve these problems, the fact that we are behind the curve and we are one of the fastest growing VA markets in the country. I've been to Loma Linda VA in California. I've been to the Denver VA. I've been across the country traveling for work and other things. The fact of we are doing our best, but we are one of the, as he said many times, we are a distinct VA. And I do want to thank you guys for what you're doing. And the fact of he's willing to stand up here once a quarter and take our abuse. And these guys take our abuse every day. So I want to give you the opportunity to speak to the fact of what you're doing to try to affect our ratio change and how that's affected you guys.
Yeah. So thank you. Yeah. Thanks for the comments. We have not enough primary care providers. Which is kind of like one of the foundational needs for us. So we're in recruitment for 20 providers, which would put us at like 130 some providers. We actually probably need around 140 something providers, to be honest with you. But right now in the VA, we're working through some challenges where we can't create new positions yet, have to wait. And so we're recruiting what we can. But the current 111-ish providers, their panel sizes, for some reason or another, this VA decided like 4 years ago that they would be at 115% of capacity. Yeah, 115%. So, I thought I was going to be a math teacher one day. So math is important to me. And I've always been told that nothing is more than 100%. It's just not physically possible. So, we've got a service where they've been told every day for years to do 15% more than God will allow you to do. Right? And every day they come to work and they try to strive for this unattainable, impossible goal. And so that's why you see, as the one veteran that left, that's why we see we're not getting the phone calls back timely. That's why you see, we're not getting the My Healthy Vet maybe responded to timely, because they have, 115, 118, 120% of their actual panels. And when I say that, it's 96%. So let's just say it's 100 providers, 96 of them are 15% above their panel. Yeah. And so, it doesn't change the fact that they're still going to see those veterans. What it changes is now the wait time's longer. And we do that because I said this to her earlier. You keep choosing to come to us. So when you choose to come to us, we don't have a secret wait list anymore, right? That was 2014. Now we put you in a panel. Now that panel's percent goes up. I just don't have any other solution other than to hire. And until I can bring them on, and then it's a slow ramp up because we don't want to burn them out. Teach them how to do the technology, teach them how to provide care. We do it much different than the private sector. And so ramping that conversation up for them. So we do have plans to hire more and make that happen. But I promise you, there's going to be a ceiling where I just won't have any more room for them, right? Unless I turn this into a clinic. And then I won't have room for town halls, right? So we're going to hit that ceiling. So I think to Craig's point, we really got to advocate to our community leaders that we need more in Atlanta, right? I love how you put it. We're doing everything we can, but there's going to be a limit. Like I said, all of us could disappear and still there's going to be a challenge for us in Atlanta. You're not going to go to the community overnight and get that care. And it's not going to be the same qualitative care. They're not going to offer the golden age games for you, right? So we have to do everything we can to continue to be resourceful. I really appreciate you thanking us. It is a thankless job sometimes to come to work every day, and especially, where you just focus on the challenges day in and day out, especially our advocates. So if you get a chance to talk to the advocates, that's their jobs, to solve problems. So I appreciate that. But there is a solution. I mean, I don't go through life thinking there's no solution to anything. So the solution is to hire, but there's going to be a limit at some point. And hopefully we'll have a town hall where I can tell you, hey, we hit that limit. Now we need to do something different.
So I had my hand raised, and I spoke a few minutes ago. I didn't get who I should contact or talk to, because the phone, it goes out. It says you are unmuted, and it does a pause. So if you're talking, I can't hear you because the system is saying you're unmuted or you're muted, your hand is lowered, and you don't hear anything else. So anyway, my point is, I didn't get who I was supposed to talk to about that. I think it was Miss Lee from Access
Yes, Kendra
regarding
Lee.
community care.
Yes. What's your email? So let me give you her email. You ready to copy?
Of course I'm not.
Can you? She's gonna drop the email in the chat for you. It's kendra.lee@va.gov. That's probably the best way.
So if you call in on the phone from the flyer, there's no chat. We don't see any slides. It's just a phone call.
Oh.
Which actually was my first question I meant to ask was, how do we see slides? Because, yeah, I actually had a procedure this morning, so I couldn't come. So I just called the number on the flyer, and you don't get any slides. You just hear audio.
How about, yeah. Kendra is her first name, just like you would think, Kendra .lee, Lee, @va.gov.
Okay, well, that's easy enough.
That's easy enough. That's the best way to probably, there you go. There you go. Thank you. She, made her name easy for us. I really do try. I mean, we're trying with Teams. I'm trying with the telephones. So I appreciate everyone bearing with us in person. And all right. Well, thanks everyone for staying. Thanks for hanging out. There's some experts in the room. If you got some specific, look, the VA's calling me right now. I'm trying to schedule my appointment. Yeah, probably. Appreciate you bearing with us and listening to all the information, but mostly I appreciate you advocating, right? Continue to advocate to your fellow veterans about what we've got going on. You know, I do love it that you come and get our care with us, but also love it that we have options for you to get the care in the community. And we're not going to always get it right. And when we don't, you have to let us know so we can fix it. All right. So thanks for bringing it up, and appreciate you guys, and hope you have a good Merry Christmas, Happy Holidays, and wish me luck. Pray. Where'd that chaplain go? For all of us. Pray for us next week. Thanks.